Hi everyone, my name is Prajakta and as you have already read the titles, I passed my NCLEX RN in 85 questions in the first attempt. So I just thought of making this video and sharing my entire experience, the resources I used, my preparation journey, as a lot of people have been asking me since they came to know that I passed, as a lot of guidance is not actually available around us. So this is completely a frank experience that I had. It is not at all sponsored or anything like that. This is my own experience, as subjective as possible. Anyways, the question number one which we have mostly is, what is NCLEX? So NCLEX is National Council Licensure Exam, which usually the nurses take to be eligible to work in the three major countries that are Australia, USA and Canada. Now the exam is completely computer adaptive, which means that the computer adapts to every question you answer, and then it will be asking you maybe a harder or easier question depending on the previous question that you answered. NCLEX will have at least of 85 questions, which means everybody will have 85 questions. But if you did not perform so well in the previous 85, you will be going on until 150 questions, which means minimum is 85 and maximum is 150. To complete the questions, you will have the time period of 5 hours, which is good enough time period, I think. That being said, question number 2 that is being asked is, how long does it take to clear the NCLEX? Now, everybody of us, whoever has even thought about NCLEX, might have this question always running behind their head. For me, it took 5 months, and I think it is completely subjective. It depends on what resources you are using, at what pace you are studying, how much energy you are putting. But I personally believe that anybody can crack NCLEX within 4 months. 4 months is just a good enough period for anybody to clear NCLEX. I also think that the newly graduates who have just have their theory read and given exams and all of that, a period of 2 months would really be good for you. But you decide how you prepare. You just evaluate how you do it and then decide your time. But it worked for me within 5 months. It might work, it should work within 4 months. 4 months is great time. Question number 3, and maybe the most favorite question among all of us, is what resources are important to clear NCLEX? I'll share my resources that I used. First off, let me just say I used coaching. I did take coaching from Rudra Academy, which is run by Miss Neha Patel, who is in USA right now. She is working as a nurse practitioner. She's an NP there, and she has been teaching since I think more than 15 years now. So I had to take coaching because I think I was not ready to sit and study for more than one hour, I think, the day I started preparing for my NCLEX, that is 1st Feb. So I just thought that self-study would not be possible at this point of time. So I just thought, let's give it a try. Let's do coaching. I would say this has to be your goal, and if it is your goal, you should decide, you should sit with yourself and just think about it, that you have to clear this exam. Whatever the exam takes, you'll have to give. You have to be ready to listen to every demand this exam is going to make and pass this exam. Is as simple as that. Anyways, so about the resources, first thing I used was the coaching material. They usually give the notes, which is if you don't want to take coaching, or if you don't have the coaching notes, all you can do is use Saunders book, Saunders NCLEX RN book, which is absolutely phenomenal, which has every content in a very precise manner. People also say there are some mistakes, but you'll figure it out. Trust me, if you are in this journey for a long time. Alright, The third resource which I used obviously was UWorld. Now, I specifically used UWorld for practice questions. I did around 2000, I think 2200 questions out of 2700 questions that they have. And that has helped me like anything. I mean, there is a lot of debate about UWorld is good or Archer Review is good. Now, again, this is subjective. You choose what works for you. Different things work for different people, and you decide for yourself. You may take a free trial that is available on both the platforms and see what really suits you, and then pick your own platform. The fourth and the last resource that I used was obviously Mark Kliemek's lectures. He is the cherry on top. All the resources that I have used, I think he is absolutely amazing. Now, the people who don't know, Mark K is a professor who has curated 12 audio lectures, out of which you get around 90% of the things on your exam. You are going to see it, especially the prioritization with audio. Also, that being said, I would say Dr. Sharon's videos about prioritization, gold. It's completely gold. Just go and watch it. All the resources that I said, be it Saunders' book, UWorld, or Mark K's audio, or Dr. Sharon's video links, I'll be putting all the links down in the description, so you may just go and check those out. So that is all the resources I have used for my NCLEX. Nothing else. Just don't overwhelm yourself with a lot of resources. Everything is not going to go in your mind, or you are not going to remember everything that you're reading. Just focus on the important topics. Safety, as everybody says, NCLEX is a safety exam. Please focus that you have to save your patient no matter what. That's it. This resources would be more than enough for you. Alright, question number 4. How to do practice questions. A lot of people, even after having a lot of theory knowledge, are not able to pass NCLEX just because they haven't done enough practice of the NCLEX questions. So this is a very important part. In fact, I have watched a lot of videos which said that there's no importance of studying all of this theory and all of that. Just go and do a lot of practice questions and you will. I don't actually 100% agree to it, because that's not possible. You cannot attend a question without knowing a theory very well. What I suggest is, you may use UWorld or Archer Review, whatever suits you, as I said, and do at least 1500 to 2000 questions before entering your NCLEX. Just do it and you'll be fine. The last question that we have on the list is what to do just before the exam, like 1 month or 1 week far of your exam, or what to expect on the exam day. So I suggest right before 1 month, what you have to do is do one CAT or computer adaptive test every single day. Don't let this go. Do every CAT exam every single day, no matter where you are going, what you're attending. Just do it. You will be fine. You will know how to sit for 85 questions, how to sit for 150 questions if it is asked, or how to just sit for 5 long hours if you have to. Please do it. Very important tip, or say a thing that you have to do. No matter if you have 2 days before your NCLEX, do 2 CAT exams. Just do it. So you will know how much time you're allotting to one question, or how long does your test go. Alright, so what to expect on the exam day? I think please carry your passport and your ATT, that is authorization to test, that you'll be having with yourself. Nothing else is required. These 2 things enough for your exam. So you'll be taken to the exam hall. Whenever you enter the exam center, all your things that you're carrying, your bag, mobile phones, bottles, or anything, will be sealed into a bag, and you will be given an allotted locker where you have to put all those things and then show your passport, identify yourself, and then they will give you a booklet. So in the booklet there will be various things like the policies of the exam center, what you should do and what you shouldn't, etc. And when you're done reading it, you may just go give your fingerprints, your palm vein test and your photograph, and you'll be good to go to escorted to the exam desk. So now when you sit in front of the exam desk, you must have previously explained all the things that you have to do. You'll have to raise your hand if you have any doubts, if your computer shuts off in the middle. Like say 85 question, you ended your test, the computer will be all darkened, and then you will have to raise your hand so that they'll help you, guide you everywhere. Other than that, a lot of people have questions that we have drug calculations and all of this. Do we get an extra pen and paper? Well, you don't get pen and paper, but you definitely get an erasable pad where you can just write. You are not allowed to erase it. Just remember that. It is an erasable pad, but you are not allowed to erase it. So you do get a rough work pad. You may use it. The exam hall feels very comfortable. Just don't feel anxious or stressed about the exam hall. Everything will be very convenient and comfortable to use. Just focus on your preparation. Just focus on managing your stress and anxiety, and you'll be fine. So this was it. These are the 5 most asked questions related to the exam, which at one point of time even I got. And I got answers from YouTube, obviously. So this is it. We'll be wrapping it with this, and if you still have any questions, doubts or anything regarding this exam which you want me to answer, please feel free to drop things down in the comment section. I'll be answering them. Until then, happy carrying.